So this is part 2 on how to deal with the neck by not doing chin tucks. Basically, how do you relieve tension or tightness in the base of at the base of your skull without doing chin tucks? I wish I could say that there is one exercise that will take care of that issue. But unfortunately, that's just not how it works. The neck does not end up tight if there's not a series of events that preclude that neck tension. The neck should stay relaxed until other things start to occur. So the point being, your neck doesn't end up tight. You don't get that compression and tightness at the base of your skull. That because of a forward head posture, right? Or it's really a forward neck, and then the head has to react. That doesn't happen out of nowhere. So if you missed the first video, watch the first part, and I explain how you end up like that. So you got to remember, the neck gets tight due to a series of events that have occurred over time. If it's not like an accident, if it's not like whiplash or a car accident, trauma to the head, just over time. That it occurs because of adaptations or compensations that occur due to the position of the pelvis and the rib cage. Let me just draw. So what I was saying is that the only way to open up that space, to decompress that OA joint, you can't do it really directly just by working on the OA joint. That OA joint will decompress when you reposition the pelvis of the position of the pelvis and the rib cage, and then at that point the neck can just go back to normal. Remember, the neck is the victim of the mispositioned rib cage and pelvis. That's why, people want to hear on YouTube or anywhere else that if you do this one exercise, it's going to take care of all your issues. It's going to fix this issue. It does not work like that. I can assure you it does not work like that. And if you think there's one thing that you can do to resolve all of these issues, all these piriformis pains, neck pains, hip flexor pains, whatever, you're not going to have success. And unfortunately, that means you're probably going to need help professionally from someone who knows what they're doing. I'm not saying me. I just need people to understand it's not as simple as you may think. This is a discipline. The origins of pain science is not that advanced. It's not all known. Modern medicine is not that old. It hasn't, 150 years ago, 140 years ago, I think they were still bleeding people to get rid of the humors. Remember, they couldn't see microbes. Penicillin wasn't invented until, I don't even remember, like the 1910s or teens or 20s maybe. So, more people died during the Civil War. More soldiers died from infection than from actually on the battlefield. So remember, we don't know that much yet. Pain science is really just starting to be well understood, and at this point, I think postural restoration has the best explanation of where idiopathic pain from unknown origins, where there's no trauma, no sickness, no acute breaking of the bones, where that comes from. At this point, this is what is giving us the best explanation. So, what I'm showing is, now, this is someone who's stuck in extension. Someone who's extended, they're going to end up, they extend, the neck comes forward, and then to maintain a horizontal line of sight, the head rotates. The neck comes forward, the head rotates posteriorly, and that's where you get that position of compression at the base of the skull. That's why people feel like they need to do chin tucks. They want to go like this to get that to come apart. But the problem is the spine underneath is still extended, so nothing changes. Now, if you watch the videos about the left AIC, right BC pattern, PEC pattern, remember, we're just talking about a body that's stuck in extension. You're overarched, and that's what this is showing. This person Now this can be on one side of the body, usually the left side, or on both sides. All right, the left AIC, right BC, right TMCC pattern is talking about a body that is stuck in extension on the left side. A PEC, bilateral PEC, is someone who's stuck in extension on both sides. So they're overall completely stuck in extension. That was me. Okay, but here is a rough drawing of extension. Notice this person's back is arched. Yes, it'll have, that's a simple, very, very simple. I'm just showing systemic extension. All right, this spine should have curves in it. This spine should have curves in it. But I'm just showing extended, neutral, which will not really be straight, flexed. So people who are living in extension, their body weight is shifted forward. You ask them where they feel their weight on their feet, they're probably going to say towards the balls of their feet, and usually quite often on the outside. So they got supinated feet. It looks like they have supinated feet. They have high arches. Their weight is on the balls of their feet. Their knees are probably hyperextended. They probably lock their knees when they stand. They might have very big quads and big calves because they got no hamstrings and they have no butt. They got no butt, no hamstrings. That pelvis is tilted forward. They're arched, head comes forward, and then they have to rotate their head and they're compressed. That is to keep a horizontal line of sight. Your brain has to keep a horizontal line of sight so that you can live. Okay. He's got wide open eyes. Why? Because he's in a state of fight or flight. And you know, your acuity, your visual acuity gets stronger because you're concentrating so much. You're over focusing. Oh, you might be gritting your teeth also. You might be grinding your teeth. You are in a state of extension. You have lost your diaphragms. And this is going to be big when we talk about how to resolve this issue. This person is using their neck. So they have, so here's your diaphragm. You don't have it. Your ribs are up, your pelvis is forward, your diaphragms, particularly on the left, are not in a position to pump as breathing muscles. They're probably being used to help stabilize your spine. So you rely on your back and your neck to breathe. So diaphragm, gone. We'd like to get you back to this neutral space, this neutral state. You'll have good glute development. Quads will be normal. You'll have hamstrings. You'll feel your weight pretty balanced. Maybe you'll feel that tripod that people talk about, but no one really ever has. And then, your neck is nice and relaxed. You don't have to use it to breathe. You'll be happy. Your visual acuity may decrease in a way, just because you don't have to overuse it because you're no longer living in a state of fight or flight. Now, how do you get from extension so that you can decompress the base of that skull to a neutral position so where the neck is nice and relaxed? Well, you got to put someone into a state of flexion. So remember, when they're in extension, everything is going forward. Their body is in a state of forwardness, but to not fall, they have to arch. So they're putting on a brake, okay? You have to get their body to move back. Their rib cage and spine have to move back, flexion. They got to get some bend in those knees. They have to get those hamstrings involved, the glutes involved. Rib cage has to go back. Head has to go, the head has to go back, but we're not going to move the head back. The head will move back because the rib cage underneath it moves back. Now I'm differentiating between the neck and the head. When you end up in this position, the head moves forward. It's like the neck moves forward, but then the head moves forward on top of the neck even more. Move the neck. We're not going to move the neck back. It's going to just become neutral because we're working on this. We move the rib cage back. We posteriorly tilt the pelvis into a state of flexion. And then that allows the neck just to go back to its normal position and everything's freed up. So we don't touch the neck. The neck is the victim of tension elsewhere in the body. It is a victim of the position of the pelvis and the rib cage. It is a position of your brain's inability to sense the ground properly. It's a victim of your compensatory breathing patterns, that you now need to use your neck because in extension you lost your diaphragms, and now this neck breathing and lower back breathing just further accentuates this extension pattern. So again, at no time are we touching the neck. I only touch the neck to test it out. So I'm now going to draw a different diagram, so bear with me. So if you know what a 90-90 is, which a lot of people do, so let's say you got your feet up on the wall and your butt is up in the air, you're engaging your hamstrings. How the heck could a left hamstring decompress the right side of that skull? Well, this is why. Okay, how are we going to change the situation? So this is the right side, this is the left side. As a normal patterned human being, your weight is shifted over to the right. That's what the left AIC, right BC pattern is. It is someone who has their weight, their center of mass, their body weight is shifted to the right. In this position, you've lost your left hamstring. You've lost your left diaphragm. You've lost your left adductor, your left glute medius, all those muscles. You've lost them because in order for those muscles to turn on, your weight has to be on that foot. But because you're living in this state, even when you put your weight on your left foot, your center of mass never actually shifts to the left. You see this all the time. So every time you put your weight on the left foot, it's in compensation. You're using your hip flexors and your lower back to stabilize your body on your left side when you have that weight on that left foot, which is never complete to begin with. So you've lost everything over on this left side. It's just they're not being engaged properly. On the right side, everything is just being compressed, tight. Everything is being tight because you're always over on that right side. You never get to unload it. That includes right back here at the base of your skull, particularly on the right side. It never gets to unload because you're in this state of right-sidedness. And in that position, if you are on your right side, you should have some compression momentarily as you're on your right leg. That's normal. That's just normal mechanics of the spine, the neck, and the head as you're transitioning from right side to left side. But if you never transition to the left side, this right OA joint, that back here, the base of the skull, it just gets stuck there and it never gets to unload. It never deloads. So that's what that black dot means. That black dot is meaning compression, and it never stops compressing because you can never go to the left side with true mechanics. You'll put your weight on your left leg, but in compensation. Like I said, hip flexors, lower back, that's not true left stance. And until you can do that, this situation won't change. So how could a 90-90 decompress? Because when you use your hamstring effectively on this left side, it will pull your pelvis to the left. So if your butt, it pulls your pelvis to the left and your rib cage to the left in the frontal plane and sagittal plane, and maybe even give you some rotation, some transverse plane also, but don't worry about that. Just the point being, when you use that left hamstring properly with competent instruction, using a PRI technique, it's not an exercise. Do not think of it as a gym exercise. You will fail miserably. When you bring that body over to the left, you'll now have a head. You've just done the opposite, and now you've created some compression on that left side, which is good if you're on your left leg, and the right side gets to decompress. And then you just alternate it side to side. But again, I wish it only took 199 to do that. Now, you can, actually, that happens plenty. You can get that all accomplished with, one 90-90 hip shift for the left hamstring. You can. Doesn't mean you're stable. Doesn't mean you're not going to go right back to that right side 30 minutes later, because you need a full program. But that is how you decompress a OA joint. That's why you don't need to do chin tucks, and chin tucks will be futile if you can't transition your body side to side because when you walk, here's the atlas, the top cervical joint, all right? The top cervical vertebrae. This has to happen. Alternation. That's my left side. Left side goes up, right side goes up. Left side goes up, right side. That is moving from side to side. Alternating cycles of compression and decompression. When you're patterned, you don't alternate. You're just compressed on one side and decompressed on the other. If you're in a complete extension, bilat on both sides, which I was, this head is forward and there is just compression on both sides. And that's even a more difficult situation because those people are so extended. Those are the type of people that can often develop into those torsions and things that I talk about. But the only way to decompress and relax that neck is by stabilizing the rest of the body and learning to breathe without using your neck and your lower back, by sensing the ground properly, by making sure that there's nothing visual or dental going on that's locking you to that right side, which does happen. But that is how it's done. So again, there is no one exercise, especially not an exercise, that will decompress, take away that neck tension. The neck does not live in isolation from the rest of the body. The only way that neck can decompress and relax is to get the rest of you neutral, to get you back to that neutral state and stable. But unfortunately, that takes competent instruction, and for most people, more than the 3 or 4 techniques on my website, which are great starter techniques. Any of them could theoretically decompress that OA joint back there. Doesn't mean it's going to stay, because life isn't lived on the ground. Life is lived upright. You have to be able to hold on to these muscles and do these same things and breathe in an upright position. And now your brain can, those positions will more closely match the realities of real life. So that is the answer to how you actually decompress, or how do you resolve tension in the neck, in the base of the skull, without doing chin tucks. It's complicated, but that's how it's done.